There we go. So this presentation is meant to look at wellness during a pandemic from a variety of levels and conversations with some interventions. I would ask if you have any questions, feel free to enter them into the chat box, and we can get to those at the end. I'll try to cover the content as thoroughly as I can, and then we can review questions at the end. So first I want to start with, what does a pandemic do to the human body? So when we look at the pandemic and our body and what has happened, we really, starting in March of last year, many individuals entered into this immediate and long lasting fight, flight, or freeze mode. Fight, flight, or freeze is really when your body responds. You don't recognize that you're entering into this, and you become ready to either fight, run away, or become numb and unable to respond. So an example of the fight mode, you might start to get sweaty, you might feel a little bit agitated, and an increased heart rate. You might see someone that paces, fidgeting, moving around a lot. That's somebody who might be in that fight mode. So they might not be actually fighting or arguing, but you would see body responses that align with what would happen if you were to fight. So it's that sort of agitation and inability to sort of sit still and focus. The flight mode is when your body, you see people in this mode often, they are people who like to run or exercise. You see people that it's the pen clicker when you're in a meeting where your thumb is going or their foot is tapping. There's somebody who, when you're trying to have a conversation with them, potentially is like, I gotta go, and has something else that comes up. Someone who might be quite distracted. Flight mode, you can also see somebody, again, you'd have increased heart rate, you'd see a lot of movement from this person. And then the freeze mode is that person that sort of shuts down. It's those feelings of numbness. It's that inability to respond. It's the person you ask a question to and they take a little bit longer to respond than normal. It's the person who, when you are talking to them, they're very sort of rigid. In these individuals, you might see actually a decreased pulse. You might see people who have a harder time getting out of bed. You might see people who have stopped coming to work as often, or maybe not as punctual. And so fight, flight, or freeze, they sort of all look very different. And the other important thing with this is that you could enter into any one of those. We're not all just freezers. I might freeze today based on how I feel, but tomorrow if something comes up, I might be a fighter or a flighter. And so you can enter into any one of those states pretty readily at any given time, and your body is going to respond with whatever your mind and body thinks it needs at that time to be safe. It's a protective mode. And being in this mode for hours, days, weeks, and even if you're fluctuating between the three, has long-term effects on both mental health and your ability to function. Once your body has turned on this fight, flight, or freeze, you're unable to just turn it off. One of the biggest reasons for this with COVID is that COVID has been everywhere. The pandemic is at work, it's at home, it's in the stores, it's at school. So historically, if you had some sort of event that was occurring that was causing you to go into fight, flight, or freeze, you could avoid that or escape it or move away from it. So if it was something that was happening at home, hopefully you would be able to go to work and not be a part of it. You could go outside and go for a walk. You could go on vacation, visit a friend, go to the gym. There were all these places where you could avoid having that fight, flight, or freeze turned on. However, with COVID, you really couldn't escape it. It's everywhere. And so that is what has really put our bodies into this constant state that could have some long-term effects for us. So when we're looking at the long-term effects, we're really looking at that constant anxiety and or overreaction to stimulation. People are going to use whatever resources they can that they have available to them that are easy and work fastest to help them to cope. And so with this, we are going to maybe make choices that are healthy, maybe make choices that are unhealthy. I know for me, even if we're not talking about coping, but if we're looking at like, you're at work and you're busy and you're hungry, I'm going to grab whatever's fastest and quickest for me. And that might not be my healthiest choice. That might be the candy that's in my drawer that I stole from my kid's Easter basket, or it might be the hamburger that the cafeteria has to offer. I might not run down the street to get the new yogurt parfait at the store down the street because that's going to take more time. So when we look at healthy or unhealthy, whether it's food, drugs, alcohol, exercise, sleep, whatever it is, we are going to choose whatever is most readily available to us, works the fastest, and makes our body feel the best in that moment, not necessarily long term. When the stimulus that made you want to fight, flight, or freeze, sorry, it's a lot of F's, is gone, our body doesn't necessarily just turn off what happened. It isn't like a light switch. And so your body doesn't immediately go back to working the way that it did. So you're going to start to have, or see people that start to have this feeling of no control. And that goes into that overreaction to stimulus. They're going to start to feel like something awful is going to happen. They are going to have a harder time taking ownership of their behaviors. They might start to blame others. They might start to have stress and angst and anxiety around things that didn't cause that for them before. And one of I think a pretty basic example of this, and I can, I can share personally for myself. I have 2 young kids at home, and when we were in the middle of like the heightened pandemic at the hospital, I would come to work, and I know that my fight was turned on because I was constantly trying to take care of patients, trying to protect myself, going to meetings. There were all these things that were happening, and when I got home, that fight was still on. And while I love my children, they were also trying to do homeschool, and they had their own stuff. And it was really stressful in the house because I now was overreacting. So my kid who didn't pick up his shoes, typically, I don't really care if you pick up your shoes, but all of a sudden that was a major stressor for me. Like, why are your shoes in the middle of the living room? Why are we not putting them in our closet? Um, and so simple things like that can show you that, this was turned on for me. I wasn't able to turn it off, and it was leading to this overreaction to different situations. And that's a pretty simplified version, but it can be as simple as that. And it can be as complex as PTSD and depression and anxiety. So there's like a whole spectrum here, but I want it to be relatable. So I share those types of situations with you. When we're looking at this, and what does this do to the people that we love, that we work with, that we oversee, that we take care of, and ourselves? What does this do? So the pandemic has really, it did a great job of helping all of us to sort of lose a sense of safety and comfort in places that we used to know as safe and comfortable places. So going to school for kids used to, for the most part, be a safe and comfortable place to go. Whether they loved going or not, it depended, but it was safe. And now they have to go to school. If they go to school at all, they're wearing masks, there's dividers, there's no recess, there's no changing classes, there's minimal after school activities. And so there's all of this change that can cause anxiety for them. If they're not going to school, now school isn't safe, so you can't go to school, so you're all virtual. That's a huge change. That sends a huge message to the kids. Work maybe used to be safe, and now you can't be near your coworkers, or if your office is too large, you're working remotely, or if you're in the hospital, it never really felt safe to be here. So what does that look like? Doctors' offices, in order to go now, you have to fill out a screening, you have to wear a mask, they take your temperature. A lot of the offices are saying, nope, don't come in, we're not safe to be open, please, let's use telehealth. So all of those things where you used to just wake up and go and think nothing about safety or concerns now require thought and changes to your pattern that are going to create that loss of sense of safety. Disruption to the daily routine and norms. So this one's pretty big, and I think probably at this point most people have identified their new daily routines and norms. But any change in that is going to cause anxiety for people, especially if you're kind of like a type A personality who likes order and structure. This is going to create some stress. So one of the things that I share with this, again, and I share personal examples. I do have small kids, so I'm sorry if they're not relatable, but try to relate them to, your lifestyle in some way. But again, as a working person, I think you can relate to this. So historically, before COVID, I would wake up, I would take a shower, I'd go downstairs and have breakfast with the kids. We'd all grab our stuff. I would put on business attire, and I'd put the kids on the bus, and I'd head into work. COVID hit, and that changed. So we would wake up, we would have to figure out who was logging the kids in for telehealth. Were all of their computers, tablets, whatever, were they all charged? Do we have the schedule for the day? Okay, we got that down. Who's eating breakfast? How are we eating breakfast? There's no school bus now, so who's coming to watch the kids? Now I had to think about, what am I wearing to work? Is today a day that I'm going to be on the floor with COVID and I need to wear scrubs, or is today a day that I have meetings and I should wear business casual? Do we all have masks? Do I have my hand sanitizer? Do I have my face shield? For me in the hospital, do I have my hospital shoes versus my home shoes because of the COVID? You didn't want to cross contaminate. Did I pack my lunch because the cafeteria is closed? So now I'm not buying. All of these things that historically would have taken me a half hour to kind of get out of the house now was really all of this brain power that changed up my day. Now we have a routine. There's hooks for masks and there's sanitizer at the door and there's wipes for shoes and everything is all set up, but it created a major change that can cause anxiety for anybody of any age. Then we look at financial stressors. A lot of people had loss of jobs, they had loss of income, they had new bills, medical bills that they didn't have before, trying to ensure that you have, I know our grocery bills changed with having the kids and us home working from home. The electric light bills changed with us working from home. So there's a lot of changes to your bills. The fear of illness, just that general anxiety around, am I going to get COVID? Are my loved ones going to get COVID? If I do get COVID, how sick am I going to get? Am I going to be that lucky person that doesn't get major symptoms and I'm going to be okay? Or am I going to be the person who ends up very sick in the hospital? And then the social isolation that went along with it. Like I've been saying all along, a lot of us had to work from home. The kids were out of school, restaurants closed, gyms closed. You could go visit people, but you had to be 6 feet apart. You had to wear masks. I sort of miss seeing the other half of people's faces. It's nice to be on Zoom and see teeth and smiles. So all of those things that as humans, we're social beings. Even if you're not a big social person, I'm a pretty quiet, isolated person, but I miss doing some group stuff. I miss being able to go to my kids' soccer games and just sit and talk to the parents. Now we're 6 feet away with masks on, kind of waving and secretly talking across each other. The other thing it did is it created more questions than answers. So feeling any situation you entered into or people entered into, there's that feeling of not knowing what is right and what's wrong. So questioning your own decision making. So there was I had a coworker the other day who came in, and the amount of questioning that she had and the guilt that she was building up in her own head about taking a family vacation next month, getting on a plane, they wanted to go to Disney. There typically going to Disney would be like, when are we going? How much are we going to spend? What characters are we going to see? What parks are we going to visit? Where are we staying? She wasn't even thinking about those things. She was thinking about, is it safe to get on a plane? What are the schools going to think if I take my kids out? You as my boss, are you okay if I travel? Is it allowed? What's the current policy? What if we go and someone gets sick? What if I make the wrong choice? So there were all of these questions that sort of percolated around this idea of a great family vacation that would have never arisen before. And she just had this feeling of like, I don't know what's the right thing to do for my family. And what if I get it wrong? And that's a lot of pressure for us to put on ourselves. And that's a lot to live with every day. And so it makes basic, simple things that should be fun and easy a lot harder to do. So there are some risk factors that make some people more at risk for an intense response or impact to the pandemic and all of the things that I've just been talking about. So some of the risk factors include a history of mental health issues, substance abuse, any traumatic experiences or abuse in your earlier or previous life, family instability, so divorce, loss of a loved one, changes in family dynamics, adding a new baby, things like that. Even if it's happy things, they can cause some instability and stress. And so these are risk factors that if you already have something going on for yourself that you're trying to cope with, adding in a pandemic is only going to exacerbate that more. So some common changes that you're going to see, and this is whether you have the risk factors or not, is that you're going to see just in most people a general increase in basic anxiety. And that goes back to what I talked about on the previous slides, changes in routine, social isolation, all of that is going to lead to just, if your baseline anxiety is none, you're maybe going to now be at a 5. And if your baseline at 5, you might now be at a 20. And so again, if we look at someone with a history of mental health issues, if you're someone who suffers from anxiety at baseline, now adding a pandemic is going to potentially put you into a tailspin. And so these are important things to be aware of. Increased tearfulness. I don't know about you guys, but I have seen more people cry at work in the last year than I ever had before. And whether it's work related or personal related, people are just more emotional and there's just a lot more behind that. And so you're going to see people who are more tearful. And that's not necessarily a bad thing, but being aware that that's happening. And if it's becoming a barrier to everyday life, that's something to be aware of. You're going to see the worsening health and mental health conditions. So all of this stress is going to take a toll. People with blood pressure, diabetes, weight gain, weight loss. There's all sorts of things from a health standpoint that we're going to start to see this having an impact on. And any unresolved mental health condition can also do that to your physical health as well. And then an increase in substance use. I know that on the news, and there's a whole bunch of studies that have shown alcohol use has increased during the pandemic. Social isolation is going to do that to people. Again, I said earlier, people are going to take whatever coping they know works well, works fast, and is most accessible. And often that is things that are unhealthy: cigarettes, vapes, alcohol, drugs, marijuana. All of those things are going to be things that people potentially turn to. And if you've had a previous substance use history, a lot of the AA meetings were either stopped or changed to virtual. And so there's disruption in that previous substance use treatment. Lack of access to that could potentially put you back into to using, having a relapse. So there's all of these factors that we need to just be aware of when we're looking at other people or ourselves. We've also seen, unfortunately, an increase in child abuse and domestic violence during this pandemic, as well as, like I said, the increased drug use and overdoses. There's social isolation and people remaining in the home. So historically, where kids and victims of domestic violence could get out of the home for work and school, now everyone is in the same home. There is no real safety net. If we're using drugs in the home, if we historically were using with friends, you're less likely to use as much in a group as you are alone. If you overdose alone, there's no one there to help you. So there's been a lot of really negative ramifications. And I will get to this at the end, but I also want to note that there are a lot of resources for all of this as well. And so if you are a victim of this, or you know someone who is, please pay attention at the end for the resources, and also obviously always 911 or a local hospital if there is something of a safety concern. So one of the things I had started presenting on this, and I didn't have these slides, and I got so many questions around at the end of the presentation: how do I engage with other people who don't believe in the pandemic the way that I believe in the pandemic, and the precautions that need to be taken? And so that has created a whole new level of like social conflict. Also, if we take into account, and we won't get into it, but like the political realm that we've seen in the last year or two or three, we look at the Black Lives Matter, we look at some of the events with the Asian Americans, we look at just all of the things that have been happening. How do we engage with other people around the pandemic? And everybody is having all of these difference of opinions, and there's some anger and frustration and fear, and take all of those emotions and then try to have a social interaction, and it's cause for concern. So the main thing I would ask you, or when you're talking to someone about this that's having an issue, is what is your biggest concern that you have with my loved one or the person I want to engage with not feeling the same way I do about COVID? What am I afraid of? What are the feelings I have around that? What are my concerns? Most people, when we talk about it, say that their biggest fear is safety. You know, if I feel that I need to wear a mask and social distance, but you don't, I'm afraid for my safety. So that's typically the underlying thing. But if there are other things behind it, make sure you're aware of that and understand that. And then one of the big things when you're talking to people is sharing facts. It's really easy to say to people like, you know, you being here scares me, and it pisses me off that you don't feel the same way I do. That's easy to say. That's emotion. Those are things that come out pretty naturally to us. It's a little bit harder for us to share some of the facts. I'm sorry. It's harder. It's easy to share facts that just roll off. It's harder to share our feelings. I'm sorry. So one of the things you want to do is say, you know, I'm afraid that I could infect you based on where I work, and I can't stand the thought of losing you if you were to get seriously sick. And so that's an example of something I said to someone, because I worked in a hospital, and I felt like, at least in the beginning, I was just this constant carrier of COVID, and I was afraid to see people. And so I would always base it on like, I don't want to lose you, and so I'm afraid of that. It's also, people are hearing facts everywhere. If you turn on the news, if you go to the websites, if you go on social media, whether they're real facts or fake facts, that's a question too. But there is information everywhere. No one wants to hear more information from their loved ones, but they do always want to know how you feel and how their behaviors or your behaviors impact them. The conversation, the more personal and real you can make it, the greater impact it's going to have. And then as you look at that first question I had asked and you identify kind of, or the people identify what is your biggest concern, then you need to ask yourself, is this someone I can choose not to engage with during this time? And this is a big question and it's hard. And especially because we don't know when all of this is going to end, it's a little easier now with vaccinations. And I think there's a little hope in the forefront. But if this is someone that you just don't think you can really have any sort of communication with because you're just not seeing eye to eye, if it's someone that you can choose not to engage with during this time, so maybe it's a friend or maybe it's an aunt or a cousin or somebody that you don't have to live with them, you don't have to work with them, you could create some space, and the answer is yes, then you're going to want to set healthy boundaries for yourself and spend more time away, or always offering up that electronic version of a visit. So there's Zoom, there's FaceTime. Now that it's nice out, we can also offer the, hey, would you like to go meet up at the park? And you can sit further away. You can sort of set those boundaries. And if the answer is no, that you can't choose to not engage with this person, so maybe it's a spouse, maybe it's a grown child, maybe it is your boss or a coworker, finding a quiet and safe time when you're in a calm space to be able to say to that person, I understand and respect your perspective. However, I have my own worries and my own fears. I want to spend time with you. I care about you. So in order to do that, these are the things that I need to feel safe, and list those out. I want to have lunch with you, but we need to do it outside and we need to sit 6 feet apart. I would love to go out to dinner with you. Can we find a place that has outdoor space? Whatever that might be, identify what those things are that you need to feel safe and share those. And then I appreciate you respecting my needs so that we can see each other. And again, it's based in love, it's based in concern, it's based in safety, but it also helps to set some limits for you. And taking care of yourself right now as well, a lot of us take care of other people. You also need to worry about yourself and taking care of you, because you can't take care of all those other people if you're not worried and taking care of yourself. So setting those limits is very important. As we're starting to get into the recovery phase, hopefully, of COVID and returning to the world after sort of being isolated or in illness, there's a lot of emotions and changes that go with that too. So once someone has been diagnosed with COVID or has had an exposure, there's a lot of emotions that go behind returning back to the normal. And so one of the things that gets brought up a lot is, and I've interviewed quite a few people that are in, COVID recovery, I would call it. And having been someone that had some direct exposures myself, there were emotions that came with that. So these are things that have actually come from people who have shared experience or lived experience. So there's that fear and worry about your own health and the health of a loved one. So when people got COVID, and I said this before, they didn't know how sick they were going to get. They heard all the stories of people on ventilators and people dying and passing away. And then they heard the stories of people that got like the sniffles, and there was really nothing more to it. And so they had it and they were diagnosed with it and they knew they didn't feel great, but how sick were they going to get? That's a big fear. Did I expose other people? I have this. Is it my fault now if my husband gets it, my mom gets it, my boss gets it, my coworker gets it? Is that on me? How that guilt that goes with that? The stress from the experience of COVID and having to monitor yourself. So like taking your temperature, wearing your mask, doing the tracings to see who you may have exposed, talking to your healthcare provider. There's a long CDC interview that can go along with the diagnosis. And so all of those things are steps that, I don't know for any of you who, if you've ever felt not great, having to then deal with all of these other things is really, really difficult. Then there's the sadness, anger, and frustration because others are fearful of you, or there's sort of that stigma now around COVID. And anybody who lived through like sort of the AIDS epidemic in the 80s, a lot of people have related it to that, where there's just this stigma around like, oh, you had COVID, you didn't wear your mask. What were you doing? How'd you get that? Oh, that's dirty. And that's a lot to carry as somebody who gets COVID. You're already sick. You thought you were doing the right things, and it doesn't feel good. So there's that concern. And then there's the guilt around being ill, possibly having, like I said, exposing friends or family, and also not being able to do your normal tasks or duties. So for someone who is a caretaker, someone who's a mom, someone who oversees something at work, somebody who just lives in an apartment or a house where you have stuff you have to do to maintain it, laundry, dishes, feeding a pet, watering a plant, whatever it might be. There's that guilt around not being able to do that, and that feeling of just not being able to perform up to speed. And with COVID, a lot of people have the fatigue and some of the illness for weeks and months. And so this is why it becomes, there's so much guilt that's long term. I talked about the embarrassment a little bit. Then there's that frustration. And I can speak to this one. When I had the exposure, I had an exposure right before Christmas. I decided to go with a peer. We grabbed a drink after work real quick. And 24 hours later, she tested positive for COVID. We were not socially distanced. I did not have my mask on. And I was so mad at myself for, it had been the first time in 9 months that I had actually left work or my house to do something outside of my family. I had let my guard down. It was the holidays. And now I potentially was going to get COVID, expose my whole family, my parents, my kids. I think I cried for probably a good 24 hours, which again was a little extreme, but that goes back to that fight, flight, or freeze and your response to things. But it's hard because you want to do the right thing and you want to follow all of these guidelines that the CDC and people are putting out there for you, but it's a lot and it's hard to do. And every so often we're going to have a lapse in judgment, or we're going to do something that feels good, like I said, in that moment that meets your needs right then, but there might be consequences to it. And that's hard to deal with. And then the feeling that it's the relief that all of this is over for you. But then there's the worry about reinfection. And now with the vaccine, do I get vaccinated? Do I not get vaccinated? I've already been sick. Do I get it? And all of those questions and worries are there too. So getting into how do we maintain our lives and cope? Like what do we do to try to get through all of this and be as normal as possible? So trying to maintain familiar routines, even if they're new, is important. I touched upon that before, but creating a daily schedule so that your family knows what it is really important, so that you know what it is. Even if every Monday looks different than every Tuesday, as long as you know for that next day or for those next couple of days what it looks like, that's important. Maintaining typical bedtimes, and this is not just for children, this is for all of us. Sleep hygiene is so very important. If you don't get a good night's sleep, it makes your next day a lot harder to cope with and deal with. And so that's why it's really important to create a bedtime routine for yourself. So making sure that you're going to bed at the same time. They say to shut off the electronics or change up the electronics when it's bedtime. So not going to bed with a TV. If you're somebody who needs that, obviously that's part of your sleep hygiene, that's fine. I know a lot of the like Headspace and Calm, they created apps for meditation and sleep. A lot of them were free during the pandemic. They're pretty cost effective too now. They're not super expensive. And so if that's something that helps you at night to do before bed, there's sleep stories, there's music, there's meditation. But whatever that bedtime routine is for you, maintaining that. And trying to be as consistent with that as possible, because what that does is it tells your brain and your body, hey, she's getting ready or he's getting ready to go to bed and we need to start to shut down. And that's very important. Creating quiet and safe space in your home or your work is also very important. And this is one that I had created in our house, and I actually fully intend to continue to have it once the pandemic ends because it's amazing. But identifying an area in the home where anyone can go to just take a timeout or take space. And again, it's not like a punitive timeout. It's just I am so overwhelmed by all of us in the house. I'm the noise, the media, like there's just too much going on. I need 5 minutes by myself. I don't know about anybody else. Again, as a mom, I used to lock myself in the bathroom for 5 minutes, but they still find you. So it's not always quiet. So for this, and this is just an example, in our house, we have a finished basement. We created a corner in there that had a beanbag chair for the kids, and it has a basket. It has like a bottle of water, it has tissues, it has a stress ball, has gum. I have a son that has like some sensory stuff. So it has sensory items, has my book. I put my book in there. And so for 5 minutes, if I just want to go take space, or my 5-year-old says, I've had enough listening to all you people up here, I'm going downstairs for 5 minutes. And anyone can use it, and it's a safe space. And so if you know someone's in that area, you don't go bother them. And it's time limited, so I can't sit there for 2 hours and not be interrupted. But we've set a limit in our house of 15 minutes. People can go for 15 minutes. If it's the middle of dinner and you need to get away, that's fine. And that really came from when we were all working from home and going to school from home, and there was just electronics everywhere and Zoom meetings everywhere, and every room had the news on, and it was just chaos. And so that safe, quiet space has been effective. We've created that at our work as well. We've called it the Tranquility Room. It's basically a quiet room with meditative music. It has water, it has a recliner, and you can just go and take space. So it's really important if you can do that for yourself and your family or your peers, that is a good thing. Utilizing healthy coping skills. So I had said before, a lot of us will look for things that are quick, fast, and efficient. If you can identify things that are quick, fast, and efficient and are healthy, those are great. Having things nearby that you can grab, that helps. I have Stress Putty on my desk now, so I can just kind of grab it while I'm at work. I carry a big bottle of water so that like I can stay hydrated and make sure that I'm taking care of myself when I'm here. But exercise is so important. Now that the gyms are back open, you can go to the gym if it's something you can do in your own home or outside, even if it's just going for a walk for 5 minutes. Moving your body helps to clear your mind. Doing meditation. So like I said, I mentioned all of those apps. There's apps you can do. There are, if you go on YouTube and you Google meditation, there are, or search meditation in YouTube, there's so many free ones, and they're anywhere from 15 seconds to 2 hours, and you can pick what works for you. And there's beginner and there's advanced, and there's some where you literally close your eyes and count to 10 forwards and you count to 10 backwards and you take a deep breath and it's over. So it doesn't have to be complicated. So finding one that works for you and practicing it. And if you've never tried it before, playing around with it and saying like, hey, how does this feel? Is this hokey? Does it feel good? It's all up to you. Personal preference. Time with family and loved ones, again, trying to connect in the best way that you can, using technology to do that if you need to. Church and religion, for anybody who is a religious or spiritual person, trying to connect through your church, trying to, whether, I know churches are, some of them are back open now, but there's online, there's TV, sometimes there's outside services. Sometimes it might just be going out and, into nature, and if you're somebody who believes in prayer, says a prayer, lighting candles, whatever that might be that connects you to your spiritual being is important to take care of. And then taking news and media breaks. I don't know, the media it's so hard to listen to sometimes. The news, it just feels always bad. There's just always something bad. And whether it's pandemic related or it's related to their shootings or racism or hate or politics or whatever, it's a lot to listen to when you've already got the stress of everything else on your plate. And so it's really important to just sort of take time to shut that off and give yourself permission to not watch it. There was like a 2-week span where I had no idea what the weather was going to be because I refused to put on the news, and every time I opened my phone, I would go to social media instead of looking at the weather. And I was like, no, I can't do it. So I'm just going to wake up and wing it because I don't want to see anything. And then asking for help and offering help is so very important. If you're not in a good spot or you're feeling like you're struggling, it's okay to say to somebody like, hey, I need to chat. I need to grab a coffee. I need some space. And if you see somebody else struggling, saying, hey, it looks like you're having a tough day. Do you need anything? And sometimes that's all it is. Ways to maintain feelings of connectedness. So we talked about this a little bit, but utilizing social media and electronic communication. So I know I just told you to put away all electronics, but also bringing them in when they're appropriate and setting good times for texting or for FaceTiming. In electronic communication, it's important to know it doesn't replace warm hugs. It doesn't replace handshakes and that connection that you get from being with people. But it does allow for at least conversation and to help with some celebrations. I know the holidays were hard and we used a lot of technology during that time, but if there's things that you can continue to do to keep that connectedness, that's important. Being of service to others. And I know that sounds silly because I keep telling you to take care of yourself, but sometimes giving back to the community or participating in something that feels like you're doing good for others can help boost how you feel, and helps to reduce some stress. So small acts of kindness or service helps us to feel connected to other people in larger ways. So things like donating to a food pantry, if you can teach an online class, adopting a pet, sending family photos to a loved one. So, I know for us, a lot of times my kids will draw a picture and we take a quick photo and we put it in the mail to my aunt that lives in Florida. That makes us feel connected to her. It's small, but it's something that's important to us. So finding what those things are for you and your family and doing it. And then keeping family traditions as close to normal as possible. So this is really important for kids and our elderly family members. It's important for all of us, absolutely. But I do think that there's some real anxiety that comes around changing those family traditions for people who are who are older in our family who have had these traditions for a long time, and for kids who are anticipating it. So, Easter just passed, but if you celebrated Easter, doing an Easter egg hunt in your own home instead of going to the town one if it wasn't safe, Zoom rooms for Passover, drive-by birthday parties, Zoom weekly family dinners, getting creative, whatever you can do. Last year, I had my husband threw a parade for my birthday. It was a drive-by birthday. I was 30 something years old getting a drive-by birthday. It was super fun though, I have to tell you. So things like that you think are silly or crazy, and nothing right now is silly or crazy. It's whatever makes you happy and feel connected. So that's really important. And then tips for self-care. So I can't stress this piece enough, is to be gracious with yourself. Allow yourself room to feel, allow yourself to have the permission to not have it all together right now. There are going to be days where, and the term I use at work is I'm a hot mess express today. And that's okay. It's okay to have those days where maybe you're tearful. Maybe we were just talking about this before we let everyone into the chat room, but maybe I didn't shower today. Maybe all I did was brush my hair and put in deodorant. All of that is okay. Giving yourself permission to not be your best self all the time is okay. It's okay to not be perfect. It's okay to not want to engage in this connecting that I talked about. Maybe you're tired of trying to connect. Maybe you just need some time alone. And then giving other people permission to do the same thing, because I think sometimes we do it for ourselves, and then we get mad. Well, Susie doesn't want to chat tonight. Maybe Susie chatted all day on Zoom meetings, and the last thing she wants to do is see your face on Zoom tonight. And recognizing that for our friends and our family, and being gracious and giving them permission to do it for themselves. It's also okay if, I just said it's okay to not want connection. It's also okay to crave connection and to want to seek it out in healthy ways. And give yourself permission to do this. I really want to get together. And, for me, I look back at that time when I got exposed right before Christmas, and as scary as it was, and thankfully, knock on wood, I did not get COVID. I was very lucky. I also think I needed that day to go and meet up with that friend. And so if I hadn't done that, I don't know what it would have looked like. So I'm glad I did it. I'm still a little frustrated with myself. I didn't make some better choices, but give yourself permission to make choices to connect in ways that you need to. And then be kind to others who are struggling, and allow them, like I said, let them to participate and meet their needs how they need to. So some important takeaways, like I said, it's okay to not be okay. You cannot be everything at all times. It's impossible to be perfect during these times. This is one of my favorite sayings, is be as calm as you can when you can, and apologize when you can't. We can only do so much, and there are going to be days where we maybe yell, or we cry, or we aren't as calm as we want to be, and it's always okay to have those moments. But then it's important to go back to the people that experienced that moment with you and just say, hey, I'm sorry, I'm really struggling, today was rough, this pandemic, whatever it is it's driving me nuts, and I'm sorry. And then give yourself and your team and your family and your staff and whoever permission to do the same thing. Creating that safe, quiet space. Admit when you don't know how you feel, or if you feel the same as someone. Creating common ground and space around the pandemic is important. Limiting the amount of time that you watch the news or read articles, creating those media breaks to let your mind heal from some of the anger and chaos that's out there. Recognizing that there's no normal when it comes to the pandemic emotional response. How you feel is not how someone else may feel. I shared some personal examples on here. You all might be like, what is she talking about? I didn't experience that. And that's okay. We're all going to be different. And if there is some common ground that you can share with other people, awesome. If it's all different, recognizing like it doesn't make Chantel a bad person if she didn't feel the way that Jess felt or Dina felt. Like it's all fine. And being open to other people's safety and comfort, to feel empowered to share your safety and comfort. And then, like I said before, asking for help, refer a friend, connecting with people to make sure that they're okay. So just some resources. I know there's people from all over, so the local resources might not stand. This is just, I'm located in New Britain, so I do them for local, but the national hotlines and support are very important. All of these are still up and running. The disaster distress helpline is open. There were a lot of natural disasters that were happening in previous months, but also this is open for the pandemic, so you can contact them and they will help you to connect for other resources. The National Suicide Prevention Lifeline, that is anybody who is having thoughts of harming themselves. a desire to die, just needs to connect with someone, you can always contact that phone number. The National Domestic Violence Hotline, they can also help anybody who is in an unsafe situation. That is a great hotline to call. And then SAMHSA is a substance abuse and mental health helpline, and that is for anybody who is looking for any mental health or substance abuse treatment. They can connect you to local resources. In the state of Connecticut, 211 is also a great resource for anybody who needs to connect with services. And then obviously 911 in your local emergency room if you or anyone you know is having thoughts of hurting themselves or others, or is just really having a hard time coping. So I want to thank you guys for coming. I really appreciate this. We'll have some time for questions and answers. If you have any future ideas for Lunch and Learns, Dina had put in the email here, and then I'll let her go through the evaluation.
Yeah, for sure. Thank you, Jessica, too. That was a great presentation.
Sorry.
We have 2 links that I'll put into the chat box. The first one is just a general evaluation, and then the second one, if you're looking for CHES credits, that's important for you to, again, put your name and state as your sign-in, and then also follow the link for your CHES credits. Now we can open to any questions that anybody has for Jessica. You could raise your hand and I'll say you can unmute yourself. You could put it in the chat box, anything that works best for you guys. I would think I'll start first. I was just at a conference actually this past week. It was the RX Summit, and a lot of things, or a lot of presenters, they brought up that a lot of overdoses and opiate use and stimulant use have gone up during the pandemic, and you said that in your presentation. It was just a grave reminder that we really need to take care of ourselves and that substances are some way that people turn to cope. So this was very great resources for people here today. I also had another question about your little calm space. Did you make it some sort of like a fort or something? My goddaughter, she made herself a fort to hang out. So I was just wondering what other things you had in your little calm zone.
Yeah, so after we created the quick one, because it was, and honestly, we created it in a moment where I thought I was just going to throw all the computers out the window at my house. There was just so much going on. So it was very quickly thrown together. But then my boys actually built a fort right next to it, and it's still standing, and that's where they go when they go down there. So yeah, you can personalize it, customize it. It's whatever you need. My favorite part is just that there's that like bubble of no one can come down and talk to me for a few minutes, and that feels really good some days.
Yeah. It's amazing what a fort or a space can do for somebody of all ages, 5 or 55, it doesn't matter.
I was thinking maybe there are people on the call who have self-care tips of their own that they would be interested in sharing with all of us. So I would definitely be interested in learning about other ways that we can take better care of ourselves if anyone has some suggestions.
So I just saw that Kristen posted that she noticed that during this time she loves being alone. In the chat box, she said, I knew I was fine with being alone, but it makes it feel like there's so much going on in the world. It's kind of a blessing to need time. And I couldn't agree more with that. And I had said I'm kind of a loner anyway. So there were definitely days where I just valued the quiet and the space that I got. So again, there's no wrong way to feel during this. All of that is normal. That's amazing.
Yeah,
I'm also, oh,
go ahead.
Go ahead, Dina.
I was just going to say, Jamie, also one of our health education committee members, thank you for being here, one. And then she also agrees that she loves her daily walks.
It's really interesting because I myself, I enjoy alone time, but at the end of the day, we all need human interaction. So as much as I do enjoy alone time, it's also important to make time to be with others and to stay connected. So at the end of the day, we're social beings that need and crave human connectivity. So that's just one thing I thought I'd share.
There's a couple of comments and questions around new moms and having a baby during the pandemic. And Melissa, thank you so much for sharing. I can't even imagine how difficult that is to go through that. And I love the idea of the to-do list, because sometimes we just need those reminders of like, hey, take a shower today. Hey, wash the dish. Hey, maybe make a sandwich. And it's simple things that help prompt us and then remind us that we need to do these things to be healthy and safe. And so that's amazing that you were able to do that. And I hope that, you're feeling better, and that if there's resources that you needed outside of, just the app and doing those projects, that you were able to reach them. If not, you hopefully have some now, and you have my email if you need anything. But for the other new moms, it's hard. It's scary too, because you don't know what's right for your baby. I know there are a lot of support groups online that you can access. I know recently I just Googled some for our outpatient clinic, and it's like mommy and me groups, but they're Zoom. So I know it doesn't replace that connection and bond between moms, but it's an option. As it's getting nicer out again, if you have the ability to go out with your strollers and take a walk with some other moms in the area, or identifying, family members. I think the other important thing is, and I know we talked about this before, but is figuring out a way, and I guess we didn't really talk about this specifically, but as a new mom, figuring out a way to remember that you're also a woman too. And how do I take care of that female person and not just the mom in me? And that's so hard with a newborn baby, especially if you're having any postpartum depression. But recognizing that it's okay that, hopefully you have a partner or a neighbor or someone that you can trust to watch the baby, again, even if it's for 15 minutes, so that you can go outside and take a walk, so that someone said that they love to dance. So blast some music and dance, read a self-help book, take a shower. Taking a shower as a new mom by yourself without the baby is probably the greatest feeling in the world. So making the time to be able to do that, put on a special face mask that you grab at Target and take 15 minutes to lay in your bed to let it sit. Whatever those things are for you, or it's so important. And so I think the one thing I would really stress is, if you can connect with other people in any way, whether it's via Zoom or those stroller walks or neighborhood gatherings, that's important if it feels safe to you. If not, recognizing the human that you were before a mom and finding ways to connect back with that person to take care of them, because it's hard.
So I think we have about 5 more minutes. I will stay on the Zoom call until the end to make sure that everybody has been able to offer up their questions to Jess. There's been a lot in here that I think Kristen also talked about her mom. I think most of the things that we said about young little babies can also be applied to that. So thank you for sharing your story. And thank you, Jessica, for your presentation as well.
Yeah, and Kristen, thank you for sharing that. With the elderly population too, anyone that was in nursing homes or even at home prior to being vaccinated, if they were vaccinated, it was hard to go and visit. And that, again, that fear and that guilt of, am I going to infect this person? Am I going to be the person who causes them harm? And there's so much fear around that. And then the fear and guilt of like, I'm not visiting, and how long do I have before I can't visit at all? And it's all so stressful. And so again, if there's any way to, try to connect, the vaccine is one of the safest ways now, but if you can go and visit outside of a window, phone calls, any sort of technology that works, but it is such a challenge. And my heart goes out to you, because taking care of an elderly parent is hard enough during a good year. And then during a pandemic it's so challenging. So thank you for sharing.
Also just had one quick question that asked if the slides will be shared. I'm not sure if Jessica can answer that, but we also have recorded today's meeting that will be able to be viewed on a later date if you wanted to see them again.
You have the slides. You can feel free, if anybody wants them emailed out. I don't mind you sharing those at all. That's completely fine.
Perfect. So if anybody would like the slides, just reach out to me and I will put my email in the chat box to make sure. I never 100% know how to end a meeting, but thank you all for coming. Normally I would be shaking hands and saying thank you, probably giving out a little goodie, but thank you all for coming today. I will stick around till everybody has left. If Chantal, you want to say one last word, but I think we're
Just
all
on
set.
behalf of the committee, thank you everyone for participating in this Lunch and Learn, and we hope to see you at future Lunch and Learns. And
Yeah.
just have a great weekend.
Yes, have a good weekend. Bye, everybody.
Mhm.